Good morning, good afternoon, and good evening to all our esteemed speakers, colleagues, and participants joining us from across the globe. On behalf of the organizers, I extend a very warm welcome to each one of you to the ECD webinar on the long reach of childhood. We are delighted to have such a diverse and distinguished audience with us today. Before we begin the proceedings, I would like to draw your attention to a few important guidelines to ensure the smooth running of the webinar. If you have questions for the speakers, kindly put them in the Q&A feature. To obtain the certificate of attendance, participants are required to attend the entire duration of the webinar and fill in a feedback form, which will be distributed at the end of the event. Please note that the Zoom closed captions are generated by AI and there may be instances where the translations are incorrect or misleading. We appreciate your understanding. Now, it is my great honor and privilege to introduce our first speaker who will deliver the opening remarks for today's webinar, Professor Joseph Haddad. He is a professor of pediatrics and neonatology and currently serves as the president of the International Pediatric Association. He is a distinguished leader in global child health, advancing pediatric care worldwide. So, without further delay, I would like to hand over the floor to Professor Joseph Haddad.
Thank you. Thank you very much and welcome to all of you. This is a very distinguished panel of speakers and really I'm very happy and I appreciate your participation in this wonderful and first series of webinars. I wish to tell you that the program area of the early childhood development is one of the most active program in the International Pediatric Association, and this is due to the leadership of this group. I wish to tell you also that early childhood development is the unique instance where the holistic approach of the child development is included. ECD is not only the child development, it's the family, it's the environment, it's the education, it's everything. It's the holistic approach and where every single anomaly could be detected, either in the children, or in the family, or in the environment. So ECD is the most important program for IPA, and I wish them all the success. And this will not be the first and unique one. I think that Dr. Suzanne will certainly enhance and boost a lot of webinars very, very soon. So now, and I'm also very pleased that all the participants come from Africa, Africa, which is the best continent that will certainly enhance the humanity towards the good word, a good word, a word fit for children. Without any delay, I will introduce the moderator, which is Dr. Alia Remtullah from Tanzania. You have the floor, Alia.
All right. Good evening, everyone from Tanzania. As introduced, I'm Dr. Alia Remtola, and I'm a developmental pediatrician. Today, I would like to say that it is a great honor to welcome you all to this international webinar on the long reach of childhood. And childhood is never just a stage, it is the foundation of who we become. The experiences, the opportunities, and the challenges that children face extend far beyond their early years, shaping their health, learning, relationships, and potential throughout life. In today's session, we will explore how nurturing care can be meaningfully woven into everyday pediatric practice, how partnerships with families, caregivers, and other sectors can drive a stronger advocacy for children, and how pediatricians can lead the way in making early childhood development a central pillar of lifelong health and well being. Thank you for joining us in this important conversation. We look forward to your insights, reflections, and shared commitment to ensuring that every child's reach is long, strong, and filled with possibility. Today's objectives for this webinar include exploring strategies for integrating nurturing care for ECD principles into existing pediatric healthcare services, how to strengthen multi-sectorial partnerships and advocacy in ECD, and to inspire pediatricians to champion early childhood development. Now, without further ado, it is my distinct honor to introduce today's panel of distinguished speakers. Our first speaker, can we go to the next slide, is Dr. Boniface Kakobwe, who is an established ECD expert with over 23 years experience in designing and management of child development programs. He currently leads the nurturing care for ECD work at UNICEF headquarters in New York. Previously, he worked in UNICEF Rwanda, Malawi, Sierra Leone, and Tanzania country offices. Prior to joining UNICEF, he managed ECD, child protection, HIV/AIDS, and livelihoods programs at Save the Children International and UNDP. Thank you so much, Dr. Boniface, for joining us, and the floor is yours.
Thank you very much, and it's an honor to be part of this series, and especially today as we kick off the series of webinars. As the president has indicated, ECD is critical, and today I'm going to run through the next 20 minutes, just the ECD as human and economic development, so as a fundamental pillar for human and economic development. Allow me, just as I share my slides. Can you confirm if you can see my slides?
Yes, it's visible.
Okay, great. So as I indicated, I'll be talking about ECD for human and economic development. As a start, maybe allow me to also define early child development. I know it's a known concept. We have used it even today, but it's good to start, having a same understanding of what we mean. First is early childhood itself. It's normally defined as a period from birth to 8 years of age. I know it's subjective, other people define it differently, but universally it's that period from birth to 8 years of age. When it comes to early child development, we position it as an outcome and not a sector. So it's an outcome that encompasses the development of children in their early years, and for children to develop physically and also talk of their cognitive development, the motor development, the language, and even social and emotional development. As I indicated, ECD is an outcome, but at the same time, it's a fundamental right for every child. In other words, it's not negotiable. Each and every child is their fundamental right. So ECD is critical for each and every child. ECD is also a critical window, early childhood is a critical window of opportunity during which interactions between young children and their environment influence their development. So it's looking at the child, but also how are they interacting with the environment in which they found themselves, and including also their families. So you heard the president indicating ECD is not only the child, but even the family, the community, and wherever the child is, as those environments, influence the children's physical, cognitive, emotional, and social development. For every child, every moments matter. Time counts. So it's every moment that is very critical for every child. As we know, just as a recap, over 1 million neural connections per second, and it's once in a lifetime building blocks of a child's future. In other words, if we miss that critical window of opportunity, we are not going to have another chance. So it's a once in a lifetime, and we have to maximize that opportunity. At the same time, we talk of responsive interactions with adults. It also helps to build a child's brain. So it all depends on how interactive the environment is, especially with a caregiver or adults. That is going to help child's brain development. Genes provide the blueprint of brain development, but the environment shapes it. I like that a lot because it's inborn. They are born with the genes, yes, as their blueprint, but at the same time, it's the environment that makes the difference. So that's why it's very critical for us to also talk of the environment where the children are. Young children also need, the kind of environment that is going to help them. And we normally talk of the nurturing care framework, which I know most of you are aware, but allow me to digest a bit. We talk of the 5 components of nurturing care. So for children to reach their full developmental potential, they need good health, they need adequate nutrition, they need responsive caregiving, they need safety and security, and they also need opportunities for early learning. And for children to develop to their optimal potential, they need all these components. And we normally say these are indivisible and interrelated. In other words, you cannot only provide 2 or 3, you need to provide all the 5 for children to develop to their full potential. There is a lot of global evidence, and this is the study that I want us also to discuss a little bit. In terms of the graph that is in front of us, you see the developmental quotient, and on the other side, you see the months of intervention. So this is a longitudinal study that was done. And if you look at the bar below, which is the blue, it's the control. So that one is the control. They looked at children who were stunted and running up to 24 months. So at the beginning where you see it's starting, you see the blue is the control and is below the other lines throughout the trial. And you go up, you see those children that were supplemented. So in other words, they received supplementary support. And the one that is in kind of greenish, here if you can see my case, those are the ones that were stimulated. And you go up, you see those that were supplemented and stimulated. And the above, the reddish one, is the one that they were non-stunted. Critical is to see that the control, they did not receive any intervention. You see their development quotient is far below there, 12 months coming up to 90, and it picks up a little bit. But those that were supplemented, it started to go a little bit up. And those that were stimulated, it's above the ones that were stimulated. And now if you combine, that's the critical point I want us to understand, they supplemented and stimulated. It's more like coming closer to the ones that were non-stunted. In other words, if you have a child who is stunted and you combine them now being supplemented and also stimulated, they are going to move towards kind of the normal, coming closer to those that are not stunted. So at the age of 31, in terms of lasting impact, those who received stimulation had significant higher IQ, and at the same time, fewer symptoms of depletion and increased consciousness and persistence in work toward a goal over time. They had less history of substance abuse and less risk taking related to health and work. So I think that's the criticality of this study that is very important. And I wanted us to refresh and also remind ourselves the critical component of that. ECD is also good for the economy. If you look at the graph, we are talking of ECD being a smart investment. This is one of my favorite statements. ECD is a smart investment. The area the investment, the greater the return. And if you look at the rate of return to investment in human capital, and you look at the prenatal 0 to 3, 4 to 5, they go to school and post-school. If you start with the prenatal, you see in terms of the prenatal programs, you experience higher rate of returns of investment on human capital. If you invest a little bit late, 0 to 3, you see it's also reducing. If you invest in preschool, it's also reducing, and at school it's reducing again, post-school is reducing. So if we want to achieve the highest rate of economic returns, need to come from area investments in the life's time. And this group, us, it's a critical group because we're in touch with the caregivers, the parents, even before delivery, and even the newborns have come. We are the first ones, to be in count of the parents, and it's very critical that we still appreciate that there's need to invest, at that critical stage. And ECD is also one of the most cost-effective ways to achieve more sustainable growth. Investments in ECD can reduce the financial strain on health, education, and also child protection systems. For governments, this is very critical and important. The economic return is as high as $13 USD for every $1 spent. So in other words, spending $1, the returns on that investment is $30, and that is very, very critical and a push for us to invest a little bit more. Access to quality, affordable childcare, parenting programs, encouraging also male caregivers engagement, and other family-friendly policies can also enable women's economic participation. So even when you talk of family, friendly policies, enable women, economic participation and empowerment, ECD also comes into that. And ECD investments are a critical social equalizer. They break cycles of inequality. As we know, the world is full of inequalities. Others have, others don't have, people in different settings, but ECD is viewed as a social equalizer. So they break the cycles of inequality and injustice, make individuals and societies more resilient to stress, and also build social cohesion and pave the way towards sustainable peace. We talk of also the Sustainable Development Goals. ECD is foundational to achievement of the SDGs. Talk of poverty. I talked of ECD breaking the poverty cycles and break the inequalities that are out there. So we cannot talk of reduction or no poverty without talking of ECD. We cannot talk of zero hunger. I talked of adequate nutrition and name it food security. We need that, and the ECD also comes into that conversation. Good health and well-being. We cannot talk about that without also talking of the child stimulation and development. Talk of quality education, gender equality, clean water and sanitation. And for clean water and sanitation, basic things like hand washing. These are the behaviors that one learns when they're still young, and ECD is critical. ECD programs help children to learn and master these, skills. Much as we have talked of the importance, but challenges still exist out there. So between 2000 and 2020, there was some progress that was made, talking of 55 million fewer children under 5 years old affected by malnutrition, and 4.5 million fewer children annual deaths among children under 5 years old. But we still have challenges before us. And when I see the bar in yellow, where we have these figures, for example, colleagues, 300 million children 2 to 4 years of age regularly experience violent discipline from their caregivers. This is not a small number. 202 million children under 5 years old living in severe food poverty. All this affect the development of children. More than 175 million children are not enrolled in pre-primary education. In other words, children just move from home and go to a primary school without any exposure to pre-primary education. And we are talking of 175 million. It's a lot. We're also talking of over 125 million children under 5 years old living in areas of high or extreme high water vulnerability. Is also a big challenge. And we're talking of over 110 million children under 5 years living in areas affected by conflict. Every time you turn on your TV, news, conflicts all over, and children are affected because it affects their development trajectory. And 110 million is a lot over that amount. 17 million children, infants under 1 year breathe in toxic air. Again, that's something that affects their growth and development. And you see on my far right, 1 in 3 children under 5 years old is not growing and developing well due to malnutrition. So malnutrition is affecting. So if you drive, in the streets, wherever you are in most of the countries, you see 1 in 3, they are actually not growing well due to malnutrition. And 1 in 3 children, 3 to 4 years of age, not developing, not developmental on track, according to the SDG 4.2.1, where we are measuring development of children in terms of health, psychological well-being, and their physical development. Children are not developing, and this is 2025. We are only remaining 5 years to reach 2030. So we need to move with speed because 1 in 3 children are not developmentally on track. And this is the only opportunity we cannot afford to miss. Just to give you an example in terms of what UNICEF is doing to respond to that, we have a vision where we want all young children to survive and thrive. Those words are critical. Survival meaning they should have life, yes, but it's beyond survival. So as we treat children, as we manage the cases, as we face the caregivers and their children, yes, let's save their lives, but it's beyond survival. They need to thrive. They need to develop. They need to have the necessary skills to survive when they grow old. So the goal for us is all young children are benefiting from policies, programs, and practices that promote child survival and optimal growth and development. And I'm underlining these words, child survival and optimal growth and development. We need to start looking beyond the survival and also talk of the growth and the development of the child. We want by 2030, at least 275 million children benefit from every year from these policies, programs, and practices that promote ECD in UNICEF program countries. So we have an ambitious target, at least 275 million children every year, so that by the end of the day, all young children can survive and grow into their full potential. And critical is also everywhere. So leaving no child behind and ensure that all children are getting the necessary support. Just to give you a snapshot of where we are, I've just put one slide in terms of our 2024 results. So we managed to reach more than 465 million young children and families through the UNICEF programs. 87 countries integrated essential ECD services in primary healthcare systems. And this is critical for us. We want more and more countries to integrate essential ECD services, nurturing care for ECD in PHC. That is very critical because, as we know, that's the system where parents, even before pregnancy, they are in touch, with the health system, and we need to ensure that the components are integrated. As I speak, we are at 87 countries. 86 countries started addressing developmental monitoring and early identification and interventions for children with developmental delays and disabilities. Still work in progress. 86 is not enough. 64 UNICEF country offices, they met our benchmark of integrating parenting support in the programs. 53 countries promoted support for caregiver mental health. I normally give this example. If you're a dad or a mom and you have mental challenges or problems, how do you support your own child? Look at the photo, on this slide. If the two parents, have their own issues, the child will also be affected. So we are also addressing the mental needs of the caregivers themselves. And 49 countries delivered early stimulation and responsive caregiving through digital platforms. And 42 countries adopted family-friendly policies. These are, breastfeeding support and also supporting, giving the parents time so that they can also more support the development of their children. There are opportunities there, which somebody may ask to say, Boniface, yes, ECD is important, but practically, what are the opportunities that we have? So I've just put these examples. Some of you have seen this before, but I just want to highlight this because we will not stop. We'll continue availing this to ourselves. We are talking of the neonatal intensive care. That's a huge opportunity for us. The postnatal consultations, that's a huge opportunity for us to bring nurturing care for ECD. Maternity care, that's also a window of opportunity for us. The antenatal consultation, we cannot miss that opportunity. It's an area that we need to capitalize on. We are talking of the well care visits are also opportunities for us, or the well care visits, that we are seeing the parents coming to the facilities. It's a huge opportunity for us. Immunization, coming for routine immunization, that's also a window opportunity for us. The inpatient care, the sick child consultations, those are the kind of opportunities that we have and we need to maximize. Care for chronic illnesses, nutritional rehabilitation. There are many, many rehabilitation centers out there. How do we capitalize on that to ensure that we are also bringing the nurturing care for ECD? Waiting rooms, bit audiovisual materials, health talks, providing playing materials, the toys in the waiting rooms. The more I go to the facilities, the more I see parents sitting, waiting, for their turn to see the practitioner. But those are opportunities that we can use, But I know there are countries like Kenya, Tanzania, Mozambique, Serbia, where I've seen these things, taking place. But we need to maximize the opportunities and ensure that more waiting rooms are doing that. Mother groups, home visits in the community, the primary healthcare and UHC basic benefit packages are also good opportunities. Allow me to end with this slide. This is, we need collective efforts to accelerate this. So for young children to thrive, parents need to be supported, and integrated policies and services need to be strengthened. So we are there to support, ensure that when country X is developing policies, the policies should integrate nurturing care for ECD. Where they are developing programs, we should be ensure that we are on the table and we are providing the next support, because this is very critical. So let's join hands to ensure that the area's agenda is championed. I see this group, if all of us can just rise up and say, I'm going to be a champion wherever I'm working in my country to ensure that nurturing care for ECD is very visible. So we need to own it and prioritize to ensure that the agenda does not disappear, but this is the time for us to do it. Multi-sectoral actions should also be accelerated, working with different teams. You heard the president talking of health, talking of education, social welfare. We need everybody, because the children need those interrelated and indivisible components of nurturing care. Investments for areas are increased as governments are making budgets. We need to be on the table to advocate for increased funding. So the budget lines for ministries of health, budget lines for other sectors, we need to be there and advocate, be it from the government coffers, be it from the private sector, be it any other opportunity which is there. We need resources to advocate and ensure that we take this to scale. So together, let us nurture the child, because this is the future of the world. And I think together we can do it. Let's just join hands. And this is the opportunity that we have. So that's why I started off by saying, I just want to introduce early childhood development as critical for human and economic transformation of the world in which we live. With that, allow me to stop and hand back. Thank you.
All right. Thank you, Dr. Boniface, for that enriching presentation. It was very nice to hear about the different, just a reminder of all the SDG goals, as well as the UNICEF vision and what the global results look like as of 2024. It is truly alarming that 1 in 3 children are not meeting their developmental milestones. But it's also reassuring to see that there are different opportunities to promote nurturing care for ECD. Now, before we move to the next speaker, just a quick housekeeping note that please post all your queries or questions in the Q&A section. And when you do, please write your name, where you're joining us from, followed by your question. So with that, I would like to introduce our next speaker. Okay, so our next speaker is Dr. Susan Wamithi from Kenya, who is a developmental pediatrician and assistant professor at the Aga Khan University Medical College, East Africa. She serves as a chairperson of the Eastern Africa Academy of Childhood Disability, the ECD project director at the Kenya Pediatric Association, and sits on the International Alliance of Academies of Childhood Disability Governing Council. Recently, she has been appointed as Child Development Subcoordinator in the International Pediatric Association's ECD, Child Disabilities and Primary Care Program. She also participates in WHO's World Rehabilitation Alliance Primary Care Working Group and peer reviews WHO package of interventions for the neurodevelopmental disorders module. Dr. Wamithi contributed to Nelson Textbook of Pediatrics Global Child Health Section, the 22nd edition, and she established Aga Khan University Hospital's first developmental pediatric service and actively collaborates on international and research and educational initiatives in childhood disability. Welcome, Dr. Susan.
Thank you very much, Dr. Let me just share my slides. All right, thank you very much again. Thank you, Dr. Boniface, for really setting the foundation on the work that UNICEF is doing. And I'll be going through the long reach of childhood, looking at the gaps and opportunities for us as pediatricians and the importance of early learning and how we integrate what Dr. Boniface shared in a practical way in existing healthcare services. And so Dr. Boniface went through this about the importance of early childhood development and that the economic productivity of a country and adult human capital is dependent on what is done in childhood. And really, I liked the emphasis on that UNICEF has is that to ensure every child is both surviving and thriving and making sure that no child is left behind. And so for us pediatricians, we're really central in supporting children and their caregivers along the life course by using our knowledge and clinical expertise to ensure that we are building capacities during the early years so that children can develop into healthy and productive members of society. Dr. Boniface has touched on the gaps and the silos because we are finding that a lot of us are doing great work as healthcare workers, as educators, caregivers are doing their best to stimulate the children's development. However, as long as we are working in silos, we really don't optimize that child who we really care for. And so this is an opportunity for us to work collaboratively. And really supporting early brain and child development involves all the multi-sectoral partnerships that Dr. Boniface talked about: government, policymakers, us as pediatricians, other healthcare workers, and the families themselves, and to ensure that children are growing up in safe, stable, and nurturing environments, and remembering that we are passing the baton from healthcare into the educators who are with these children for a really long time. So why are the early years important for us as pediatricians? So the developmental origins of disease, really it was a concept seen by David Barker, who studied the Dutch women who are pregnant, who are starving in the Second World War. And what he demonstrated that the early life environmental factors really affect the diseases that happen in adulthood. He looked at low birth weight infants and followed these children and found that they were at increased risk for cardiovascular and metabolic disease in adulthood. The other researchers who are really looking at what are those developmental exposures that are contribute to adult disease. So the risk factors being looked at and that have been seen are that toxic stress, overnutrition, exposure to infections, drugs, environmental toxins, and Dr. Boniface shared what's happening with air pollution, can potentially alter how that brain develops because of its effects on cell division in utero. And epigenetics is a really plausible molecular mechanism that links the genes that the child has, the environment they're growing up in, and susceptibility to disease through DNA methylation, where we're having chromatin and histone modification, and it influences how protein is made by a gene and ultimately affects how our brain develops. So where do we start as pediatricians? And really, a lot of work is being looked at preconception health. And building a foundation for lifelong health really begins before conception. And it's been shown to be a vital determinant of pregnancy outcomes and subsequent generation health. And this is because there's a complex interplay between that paternal and maternal preconception experiences, the genetics, the epigenetics that I touched on, and the environmental factors that influence future generations. So we really need to think about what are we doing for our adolescents in preparing them. And for our young adults, it's a potential strategy to mitigate the adverse child development outcomes. So the paternal preconception factors are starting to be seen in terms of the studies that are the epidemiological studies that shows that there are risks of adverse outcomes in offsprings of fathers who are obese, who have diabetes, who are advanced in age, and who are even smokers. And so that intergenerational transmission of disease is being studied because they're showing that those preconception environmental insults on that sperm and the transmission that is occurring, of course, during fertilization has an impact on offspring development. And again, the potential molecular mechanisms are with regards to those epigenetic factors that are affecting how our brain is developing. The maternal preconception factors are more challenging to study, and the difficulty lies in distinguishing what is the environmental induced molecular changes in that oocyte from the direct effects of environment on which a fetus is developing. So what do we do as pediatricians and even the gynecologists who we work with? And really recommendations are preconception care targeting adolescents and young adults. We have to address obesity because there's research that's showing that inflammation is affecting how our brain develops for young people who have obesity. The prevention of sexually transmitted diseases, we do know that even the tests that we do during pregnancy, the torches, that those sexually transmitted diseases affect how a child's brain develops, and even nutrition. So prenatal development really is about how that unique set of genes from both parents interact with the prenatal environment and really influences how development unfolds. And so it's really important that we ensure that this mother is safe in terms of the pregnancy, taking care of herself in terms of nutrition, and ensuring that there's no toxic stress that's affecting how the baby is developing, and so that we can mitigate things that can affect short and long-term outcomes on developmental outcomes for these patients. And so Dr. Boniface really talked about the genetic programming that's organized and sets a blueprint on how neurons and neuronal development occurs. And just as a reminder that the brain is directing the physical development, the social emotional development, their communication and cognitive development prenatally all up to young adulthood. And so we can see what's depicted here are the neurons and those supporting neurons and glial cells that help the child's brain to develop appropriately. This is a picture really depicting from how synapses form based on the early experiences. And this is from the Center for the Developing Child from Harvard. And what they're showing is that, and a lot of studies have been seen, that even children prenatally in the third trimester are able to hear their parents. Some even respond to light when it's shown on the mother's abdomen. And so we'll find that those sensory pathways, especially the vision and hearing, are already developed by the time the baby is born. So how do we encourage these parents to talk with their child? And remember, it's not only the quantity of talk, but the quality and being responsive, because you can see language is speaking when they're infants around the 6 to 9 month mark, and we want to take advantage of what is happening with brain development naturally. And then ensuring that we're supporting higher cognitive function by allowing a child to play, explore their environment, give them things to play with, to bang. And so it's really important that we're supporting those experiences and the caregivers because of when things are coming online, and ensuring that we're not missing any critical windows. So what are the benefits of early intervention? So this is a graph again from the Harvard Center for the Developing Child, that what is depicting that the younger you are, the easier it is for the brain to change in response to experiences. And the older the child is, the more effort it will take to make those changes. So it's really important that for us, when we're seeing that patient that's in front of us, when we notice something, an interaction that needs support, that we intervene early, because it does matter for this child. So the nurturing care really refers to that stable environment that is sensitive to this child's health and nutrition needs, with protection from threats, opportunities for early learning and interactions that Dr. Boniface has talked about, and being responsive, emotionally supportive, and developmentally stimulating. And what we want to add there is how to care for that caregiver. The WHO and UNICEF launched the Nurturing Care Practice Guide, and it's really created for managers and pediatric practitioners in terms of those who are managing nutrition and healthcare services. Those practical skills that are supporting this caregiver to promote responsive caregiving and build that caregiver competencies so they know what to do in terms of providing that nurturing care. And this guide really is very wide in terms of showing the diverse needs of all the children, even children with disabilities, how to provide nurturing care for them, how to play and stimulate them, children with chronic health conditions, whether they have cancer, whether they have sickle cell disease, and even children who are growing up in humanitarian crisis. We need to find ways to support them. So what do we do in terms of supporting family through existing services? That is us as pediatricians. So one of the good things that has come with this guide is just guidance, and Dr. Boniface has talked about how we can implement nurturing care within the existing services. So we're not asking you to do something new, it's where you are. Are you in the antenatal clinic as a nurse, or a pediatrician, or an obstetrician? How do we support that and take those opportunities to strengthen the caregiver practices and support caregiver well-being in the postnatal wards, in well-child visits? And I like this guide because it shows you even where you can support, whether it's in the sick child visits, whether they're inpatient or outpatient, whether we're doing nutrition rehabilitation and chronic care. And Dr. Boniface went through that. So what is our role? Our role is to look at that caregiver and help support them, help them see what is their baby doing? What does this mean? How are they responding to the child's signals? Being able to be a responsive caregiver is picking up on the cues and responding in a timely manner. What are those opportunities for early learning? And we don't have to talk about expensive toys. What is in the household can be used for banging, for playing. You talk your child through it, and helping parents see that whatever they're already doing is helping their child, and how do we build up on it? ensuring safety and security. When those children are coming through our clinics, how do we, if we see a child being given harsh discipline, how do we support that caregiver know a different way of disciplining their child in a positive manner? What are those physical dangers that can put this child at risk? What are those emotional stresses? And we talked about the care for the caregiver that's going on in the household and those environmental risks, whether it's air pollution or issues with sanitation. And taking care of that caregiver well-being, our caregiver can't pour out of an empty cup. We have to ensure that anything that you notice, whether it's depression or excessive stress, domestic violence, that we're really activating the appropriate people to help with that. So what do we do? What is practical? And I really, this is work that we did with the Kenya Pediatric Association and Pediatric Association of Tanzania, as well as supported by the American Academy of Pediatrics. We looked at how else can we build practical skills where you are, where you're working. And there's this ask, counsel, discuss approach that's that we adapted from the WHO UNICEF guideline. How do you ask open-ended questions and address that caregiver concern? Because the caregivers know what is going on with their children. And if you don't allow them to ask, we won't be able to support them. How do we counsel them? How do we support and encourage them? You're doing a good job, mom. You're supporting your child. And how do we strengthen those caregiver practices through discussions of what can be done differently to support this child's development? So that ask, counsel, discuss approach is a practical skill that you can use in where you're working as pediatricians and pediatric practitioners. So what can managers do, facility managers, to enable health and nutrition services to support nurturing care? So the Nurturing Care Practice Guide really outlines the role of facility managers in ensuring that the facilities and the services that are being provided are supportive of all the components of nurturing care. And there are 5 key areas for managers to address using an ABC approach to organize the transformation of maternal, newborn, and child services. So what does that look like? We call it as easy as ABC. So that's accessibility, barriers, capacity building, disaster setting, and enhanced support to make you remember what you need to do as a facility manager. So what is accessibility? Really, it's for you as those who are running those facilities to ensure that you're creating spaces. Is there a corner a parent can be talked to? And you don't even have to get a new building. It's just trying to figure out, is there an inclusive space that's easily accessible and welcoming for children and caregivers, even children with disabilities? Children work well when they're being seen at the bottom floor, so we don't have to worry about injuries, and even children who are in wheelchairs have access to the services. Are there any barriers, especially non-physical barriers, that are getting in the way for caregivers to access health facilities? Are things too expensive? Has there been a flood? How do we get to these parents? Are there hostile staff who we need to talk about changing their attitude towards parents and reducing their stigma towards, for example, a teenage mother or a child or a parent with a disability? How do we support that? And capacity building, really ensuring our staff are well trained in nurturing care, so they're able to identify the children who need extra support and linking them to auxiliary services whenever it's needed. D is disaster setting. How do we adapt services to humanitarian and health crises? Dr. Boniface talked about that. There are resource constraints in those areas where there's a humanitarian crisis. And how do we support to give caregivers to give that responsive care in difficult circumstances? How do we get peer supporters, somebody who is somehow thriving in that environment to be able to encourage others? It's about adapting those facilities and ensuring we're working together to help these children who are growing up in difficult circumstances. E is for enhanced support, training our personnel to identify families who need that support, for children who have disabilities, who need support where there's domestic violence, who need support where there's poverty and they need a social worker to figure out the finances for even getting medication. Ours is to ensure that our healthcare workers as managers are being able to identify these families. So in summary, our role as pediatricians and even pediatric practitioners is to ensure that we're supporting from preconceptually. When a young adolescent is coming in, you're noticing that they're taking drugs, you're noticing that they have alcohol, or they're smokers, or they're obese, or there's some other issue going on with that young adolescent. Having those discussions so that they start making good choices that will influence how the environment for that baby in terms of the preconception health. that pregnant mother, the father involvement is important, ensuring the families are supporting each other, because all of that plays into factor on how our brain develops. And eventually, as Dr. Boniface shared before me, is that economic productivity, that human capital of a child, for them to be able to learn in the education sector, we need to do something to prepare in terms of school readiness and ensuring that they're growing up healthy and children who behavior is being supported in terms of their development. And so I acknowledge the partners that we've worked with, and especially for WHO and UNICEF, with that practice guide that we've been able to share and train on. And thank you very much. And I'll hand over back to Dr. Arena.
All right. Thank you, Dr. Susan, for that thought-provoking and insightful presentation on the very broad subject that is ECD. And the ABCs are definitely an excellent approach. To make the most of our time, we will now proceed to the Q&A session. And participant questions will be projected on the screen and read out for our speakers to address.
May I just give me 1 minute in order to just sum up something that's very important? Epigenetics and plasticity of the CNS are closely linked. That's what I want to tell you. Plasticity of the brain is strictly correlated to the environment and to the epigenetics. And the earliest intervention are the better. And this is very well known and attested by newly scientific evidence with PET scan and simulating PET scan and so on. Thank you. This is just to emphasize on of plasticity.
Well said, Prof. Haddad. Thank you for that. So we're now jumping into the Q&A session, keeping in mind the timing. Right. Okay, so the first question is from Celia Kariuki. And the question is that in the Jamaica study mentioned by Dr. Kakobwe, when they say stimulated and supplemented, what kind of supplementation was given? Was it a micronutrient or macronutrients? And was it a standardized intervention? Over to you, Dr. Boniface.
Great, and thank you again for the opportunity to be here. We also provide a link to have access to the whole study, because I think it's the study that has provided guidance to the whole ECD programming, I can say, so we'll keep on referring to that. So this is standardized intervention. They looked more on the micro supplements. And so I think to answer your question, it was more of the micro supplements and it's more of the standardized intervention. Yeah, but we provide the paper for people who want to read and get more details. Thank you.
All right, thank you. We can move to the next question, which is from Merab Akinyi in Kajiado County. And the question is, she is an infant mental health practitioner in Kenya, the first certified first play infant therapist in Africa. And she would like to ask if UNICEF is looking at infant mental health as a way of early intervention. I think this goes also to you, Dr. Boniface.
Yeah, thank you, Merab. Coming at a good time, this question, because an hour ago, before I came to this webinar, I was presenting also in the Kenya Technical Working Group on ECD, and we were invited to present on caregiver mental health and well-being. We have developed a package we call Caregivers, Caring for the Caregivers, CFC. So it's also on a UNICEF SharePoint, Caring for the Caregiver. You can check and find it. The package is meant also to support the well-being of the caregivers and the parents. For a start, we're addressing the needs of the parents to provide nurturing care to their children. But I know there's also need to go specific now to the needs of the children themselves. But in that package, we are talking of more of, starting with, addressing the needs of the caregivers. But broadly as an organization, mental health for children and caregivers is part of our programming. But the package I've given references for caregivers. But in terms of our broader programming, we also know that, kids themselves, they also need help in terms of their emotional needs. Thank you. But look out for that. As I indicated, Kenya is at a stage where they want to take up the intervention. Thank you.
Thank you. Dr. Susan, would you like to comment on this?
So when it comes to, infant mental health, and I'm assuming we're talking about neurodevelopmental conditions, whether it's autism, and whether it's also supporting the cognitive development and behavior, because we are encouraging healthcare practitioners to screen for any irritability or any behavioral issues that are being seen in the early years. And we always look for medical things first before we, before we say this is a mental health issue for a child who's under 1 year of age. So and that's why play is important. And I think we talked about that in terms of how to play and communicate with the baby as a way of building their cognitive development.
All right, thank you. And I agree, interaction and interactive play in children, especially during the early years, makes a significant difference, as you saw from the graph that was projected. It's all about stimulation. Okay, so we can move to the next question. Okay, all right. So
Dr. Leah,
I guess
Dr. Leah, you
questions.
can
Yes.
read the question directly from the Q&A from Alice Mundia. It's the last question.
Okay. Yes, here we have. The question is, my name is Alice Mundia. I chair an organization, Differently Talented Society of Kenya. I am also a caregiver and mother to an autistic young adult. My question goes to Dr. Susan. What role does epigenetics play in the onset of neurodevelopmental disabilities? And what can mothers do pre-conception as a component of the foundation of lifelong health and well-being? Over to you, Dr. Susan.
Thank you, Alice Mundia, for your question. And so the aspects that we really emphasize as we've gone through the talk is about that preconception health in terms of the wellness, the adolescents, and the risk factors that we've seen with obesity and smoking. And even there are studies that are looking at alcohol. And so there are neurotoxins that can happen even when you're pregnant. If you're taking alcohol, it can predispose you to fetal alcohol spectrum disorder, which can also predispose you to autism spectrum disorder, because there's that association. But really, there are a lot of gene environment interactions that I had to really point out for autism, because there are underlying genetic conditions like Down syndrome that's also associated with autism. So what we would encourage caregivers is the aspects of, because we've talked about toxic stress, we've talked about neurotoxic and neurotoxicants, whether it's that drug that you're taking, because whenever you're pregnant, there are certain medications that the gynae will tell you to avoid. And really for our paternal, because there's a lot of work looking at paternal preconception health and ensuring that our young male adolescents are also healthy and taking care of themselves. And just because of those epigenetic changes that are happening to the sperm itself. And so, because we never want to tell parents that you're the one who's caused this condition, but we do want to reduce risk factors that are known, like alcohol, smoking, obesity, and air pollution and lead that can affect how brain develops and predispose you to neurodevelopmental conditions.
Okay,
Alia, can I
Yes,
follow
go ahead.
up? Can I follow up with what Susan has said?
Yes.
The question is, what is the role of epigenetics? Epigenetics is a sword with a double edge. It could be harmful and it could be helpful in both in each period of your life. Like Susan has said, there is a lot of factors that are epigenetically will stress you in during the conception and the pregnancy, and other epigenetic factor may reduce those, like nutrition, like caregiving, like environment. So epigenetics, it's a swear with a double H. That's what I wanted. Yes, epigenetics has a role in every single disease that we have, either positively or negatively. Thank you.
All right. Thank you for that, Prof. Haddad. Now, as we're approaching the end of today's discussion, so I would like to portray that one message stands out very clearly, and that is that what happens in the earliest years does not end in childhood. It echoes into adulthood, into communities, and even into the next generation. And this is what we call the true long reach of childhood. Our discussions have shown today that when pediatricians integrate nurturing care into everyday services and when systems embrace the nurturing care framework, we create a stronger foundation for healthier and more resilient societies. Now, with that, I would now like to invite our speakers to leave us with any of their closing thoughts, remarks, a brief take-home message or food for thought as we carry on and continue this vital work. I'll begin with Dr. Boniface, followed by Dr. Susan, and then closing with Professor Haddad. Welcome.
Thank you, Dr. Alia. I would say we have evidence, we have the information out there. What is missing is putting that into action. So there's a huge gap between the information available out there and what is happening in practice. So my appeal is, as we go back to our routines, asking that question to say, am I doing enough to provide, to support provision of nurturing care for ECD? So every opportunity that we have, let's maximize it. But because we cannot just maximize that opportunity alone, let's strengthen the national systems, because it's the national systems, the national policies that deliver and that support the development of children. With that, thank you very much for the opportunity to be with you today. Thank you.
Thank you. Dr. Susan, welcome.
Yes, I really want to echo what Dr. Boniface has talked about in terms of encouraging healthcare workers to be proactive in supporting caregivers, nurturing skills at those different entry points of healthcare. So it's like the opportunity is presenting itself every day, and to remind ourselves that that extra support that you're giving is actually supporting the economic productivity of your country. And so when we look at that bigger picture that UNICEF has set out for us, then we know it's the small things, it's the day-to-day experiences that we have with our caregivers, with that challenge that's in front of us, to ensure that they are meeting their potential and ensuring that we are supportive of the same and referring those who need support. Thank you.
Well said, Dr. Susan. And finally, Prof. Haddad, welcome.
Yes, thank you very much for all the panelists that have participated to this meeting, but also to those who are following us. I see that there is 71 who has followed us. Thank you all, Abdullah, Ahma, Alice, Anastasia, Anisa, Anna, Anikwa, anybody, everyone. And the last one is, let me see what's her name, Winston Anunda. Thank you all for coming to this. And Susan, I wish that you will persist and continue giving us those wonderful presentation with Boniface, and the wonderful also moderator Alia Ramtullah. So see you very soon on the screen, and stay tuned, all of you, with the IPA. Thank you.
All right. Thank you, Prof. Haddad. Now, with those insightful thoughts, we officially conclude the panel discussion. But before I hand the floor back to the IPA team for the vote of thanks, I'd like to invite all the attendees to our next discussion on the science of early childhood development, which is tailored for both clinicians and parents. And I encourage you to follow the IPA on social media for further updates. Thank you and have a great evening.
So on behalf of IP, we would like to extend our sincere thanks to all the esteemed speakers and our president for your valuable contributions and for active participation of all the participants. So here is a kind request to all the participants that you can just scan the QR code here and just fill the feedback form so that we can issue certificates for you for the webinar. Thank you.